Varicella, also known as chickenpox, is a highly contagious disease that causes a very itchy rash that lasts for about a week. This disease usually presents with fever, tiredness, loss of appetite, and headache. Although it is usually a mild disease, children under 12, infants, pregnant women, and people who are immunocompromised have a much higher chance of the disease becoming very serious. Complications of the disease include skin infections, pneumonia, swelling of the brain or encephalitis, and joint infections. Before the varicella vaccine, chickenpox was a very prominent communicable disease, and due to the herpes zoster virus, chickenpox usually leads to shingles later on in the child's life. It is highly encouraged that children be vaccinated against this disease starting at 12 months old and once again no later than 6 years old. People advised against getting this vaccine would include people who have a weakened immune system, active TB, or any other live vaccines given within the past 4 weeks. Influenza, also known as the flu, is a very contagious viral respiratory disease. This disease can be very mild for the ideal healthy individual with a strong immune system. However, it can be very dangerous and in many cases deadly to the very old, the very young, and the immunocompromised. Although the flu can be caught any time of the year, its prevalence begins to increase significantly in October, peaks around December to February, and can last all the way through May. So it's very important for all individuals 6 months and older to receive a yearly flu vaccine. There are 2 forms of the vaccine available. One is the injection, which is going to be a dead virus. The other is a nasal spray. The nasal spray is a live virus and is not recommended in pregnant women or people who are immunocompromised. Studies have shown that children who receive the flu vaccine have drastically reduced chances of dying from this highly communicable disease. Meningococcus is a very dangerous disease that causes the lining of the brain and spinal cord to become infected. This disease almost always leads to hospitalization and can often be very fatal. Signs and symptoms include, but are not limited to, high fever, severe headaches, neck stiffness, nausea and vomiting, drowsiness, and joint pain. It's highly advised that all 11 to 12-year-olds be vaccinated against this disease. Once the child reaches 16 years old, a booster dose should be administered. If pregnant or breastfeeding, the vaccine should not be administered. Furthermore, immunocompromised clients should not get the vaccine either. The pneumococcal virus is a communicable disease that can be spread from the nose when one coughs, sneezes, or breathes. This disease leads to pneumonia, which is a respiratory disease that causes the air sacs to fill with fluid. This can lead to compromised gas exchange. Signs and symptoms include chest pain when you breathe or cough, confusion or changes in mental awareness, productive or non-productive cough, fatigue, fever, and sweating. Older adults and children under 2 are very susceptible to this disease. It can be fatal among the older population. For this reason, it is highly advisable for all adults over 65 years of age and all children under 2 years of age to have this vaccine. Additionally, this vaccine is recommended for adults between the ages 2 and 64 if they are smokers.
Measles is also called rubeola. It is spread through the air and can be serious in all age groups, but especially small children. Symptoms typically appear 7 to 14 days after infection and include a high fever, cough, runny nose, and red watery eyes. Tiny white spots called Koplik spots may appear inside their mouths. A rash with flat red spots breaks out on the face and body. Some people may suffer severe complications such as pneumonia and Mumps is a contagious disease spread through direct contact with droplets. Mumps is best known for the puffy cheeks and tender, swollen jaw it causes. Other symptoms include headache, muscle aches, tiredness, and loss of appetite. Complications from mumps can include pancreatitis, encephalitis, meningitis, and deafness. Rubella is usually mild with few noticeable symptoms, but for people with the symptoms, a red rash is typically the first sign. Other symptoms include a low-grade fever, headache, mild pink eye, general discomfort, swollen and enlarged lymph nodes, cough, and runny nose. In rare cases, rubella can cause serious problems like brain infections and bleeding problems. The most serious complication from rubella is the harm it can cause a pregnant woman's developing baby. It can cause miscarriage or her baby can die just after birth. Also, she can pass the virus to her developing baby, who can develop serious birth defects such as heart problems, loss of hearing and eyesight, intellectual disabilities, and liver and spleen damage. Measles, mumps, and rubella can be prevented with the MMR vaccine. The CDC recommends children get 2 doses of MMR, the first dose at 12 to 15 months of age and the second dose at 4 to 6 years of age. Adults and teens should be up to date.
Diphtheria is an infection that is spread from person to person, usually through respiratory droplets like coughing or sneezing. Rarely, people can get sick from touching open sores or clothes that have touched open sores of someone sick with diphtheria. A person also can get diphtheria by coming in contact with an object like a toy that has the bacteria that causes diphtheria on it. Getting vaccinated is the best way to prevent diphtheria. Healthcare professionals give DTaP and DT to children younger than 7 years old, while older children, teens, and adults get Tdap and TD. Tetanus is an uncommon but very serious disease caused by the spores of a bacteria found in the environment. When the bacteria invade the body, they produce a poison that causes painful muscle contractions. Another name for tetanus is lockjaw. It often causes a person's neck and jaw muscles to lock, making it hard to open the mouth or swallow. The CDC recommends vaccines for infants, children, teens, and adults to prevent tetanus. Several vaccines protect against tetanus, all of which also protect against other diseases such as diphtheria and pertussis. Children who should not get vaccines that contain whooping cough can receive DT for protection against diphtheria and tetanus. CDC also recommends 1 dose of Tdap for adults who have never received it. The easiest thing for adults to do is to get Tdap instead of their next regular TD booster. Pertussis, also known as whooping cough, is a highly contagious respiratory disease. Pertussis is known for uncontrollable, violent coughing, which often makes it hard to breathe. After cough fits, someone with pertussis often needs to take deep breaths, which results in a whooping sound. Pertussis can affect people of all ages, but can be very serious, even deadly, for babies less than a year old. 2 vaccines in the United States help prevent whooping cough: DTaP and Tdap. DTaP consists of 5 doses spread out between the ages of 2 months old to 6 years old. HPV, which is short for human papillomavirus, is a group of more than 150 related viruses, all transmitted through intimate skin-to-skin contact. Each HPV virus in this large group is given a number which is called its HPV type. HPV is named for the warts or papillomas some HPV types can cause. Some other HPV types can lead to cancer. Men and women can get cancer of the mouth and the throat, the anus and the rectum, and they're caused by HPV infections. Men can also get penile HPV cancer. In women, HPV infection can also cause cervical, vaginal, and vulvar HPV cancers. The HPV vaccine can prevent infection of the types of HPV that most commonly cause cancer. Most people with HPV never develop symptoms or health problems. Most HPV infections, 9 out of 10, go away by themselves within 2 years. But sometimes HPV infections will last longer and can cause certain cancers and other diseases. Every year in the United States, HPV causes 33,700 cases of cancer in men and women. HPV vaccination can prevent most of the cancers, about 31,200, from ever developing. HPV is so common that nearly all men and women get it at some point in their lives. HPV can be passed even when an infected person has no signs or symptoms. Also, you can develop symptoms years after being infected, making it hard to know when you first became infected. HPV vaccine is approved by the FDA and is recommended by the CDC for both males.
Hepatitis A is a serious liver disease that leads to fever, nausea, vomiting, and jaundice. It is contracted through contact of stool from someone that is infected. It can also be contracted through food, water, and contaminated objects. The Hep A vaccine is an inactivated vaccine. The particular vaccination is given in 2 doses. The first dose of the vaccine is recommended for children 12 to 23 months of age, and their second dose is given between 16 to 18 months later. Minor problems that can follow the vaccine in children are low-grade fever, headache, tiredness, and soreness or redness from the injection. Hepatitis B is also a liver disease that can lead to lifelong illnesses. Hep B is spread through semen, blood, or other infected bodily fluids. It can be passed through birth, sharing hygiene items, sex, or sharing needles. This vaccine is usually given in 2, 3, or 4 doses within 1 to 6 months. Infants should receive their first dose at birth and should have completed their series by 6 months. Haemophilus influenzae type B is a disease caused by a bacteria that can lead to other diseases such as meningitis. Depending on the brand of the vaccine used, there are normally 3 or 4 doses. First dose is usually given at 2 months of age, second dose at 4 months old, third at 6 months of age, depending on the brand of the vaccine used, and the fourth given at 12 to 15 months old. This vaccine can be given with other vaccinations, and it can also be given as a combination vaccine.
Children who get infected with rotavirus may have severe watery diarrhea, vomiting, fever, or abdominal pain. Vomiting and watery diarrhea can last 3 to 8 days. Additional symptoms may include loss of appetite and dehydration or loss of body fluids. This can be especially dangerous for infants and young children. Adults who get rotavirus disease tend to have milder symptoms. This vaccine is a 3-dose series recommended at 2, 4, and 6 months of age. Polio spreads from person to person, invading the brain and spinal cord and causing paralysis. Because polio has no cure, vaccination is the best way to protect people and is the only way to stop the disease from spreading. Polio is a crippling and potentially fatal infectious disease. There is no cure, but there are safe and effective vaccines. Therefore, the strategy to eradicate polio is based on preventing infection by immunizing every child to stop transmission and ultimately make the world polio-free. This vaccination is a 4-dose series. Shingles is caused by the varicella zoster virus, the same virus that causes chickenpox. After a person recovers from chickenpox, the virus stays dormant or inactive in the body. Scientists aren't sure why the virus can reactivate years later, causing shingles. It is a painful rash that develops on one side of the face or body. Other symptoms of shingles can include fever, headache, chills, and upset stomach. Anyone who has recovered from chickenpox may develop shingles. Even children can get shingles. However, the risk of shingles increases as you get older. The shingles vaccination is recommended for ages 50 and older.